Good afternoon, everyone. As you know, the spread of the coronavirus has captured the attention of the world, this nation, and here locally. Orange County and state officials and local officials are working to keep all citizens in our areas and the surrounding counties safe. Mayor Demings is leading our safety efforts here with other local health officials, whom you will hear from in this press conference. With those details, Orange County Mayor Jerry Demings. Mayor.
All right, thank you, Dr. Williamson, and thank you all for being here this afternoon, especially with such short notice. We know our Orange County residents have questions and concerns that need to be addressed. We hope to do that with all of the experts who have gathered here this afternoon. Before I introduce our guests, I would like to welcome our county commissioners, Myra Uribe, Commissioner Moore, and Commissioner Gomez-Cordero, who have joined us here this afternoon. Now let me also introduce the following officials who will be speaking this afternoon. Of course, our very own Orlando Mayor, Buddy Dyer, is here. There may be some city commissioners who may come in, and we will introduce them as they arrive. Also representing the Florida Department of Health in Orange County, Dr. Raul Pino, Orange County Public Safety Director Danny Banks, Health Services Director Dr. Yolanda Martinez, Orange County Fire Chief Jim Fitzgerald, Orange County Convention Center Executive Director Mr. Mark Tester, and George Argel, the President and CEO of Visit Orlando. I want to stress to all of you that our monitoring and planning for the coronavirus has been going on since January 29th, when county officials met with area hospitals for the first time to talk about the threat. We at Orange County have been monitoring and planning for the day the coronavirus would become a public health emergency in our community. And that day, of course, is today. With 2 cases in Florida, but well outside of Orange County, we believe it is a matter of time before we have a case right here in our backyard. We want to emphasize that while the coronavirus moves at a fast pace, we are remaining calm and have been working behind the scenes with our partners at the Florida Department of Health. This news conference is to reassure you, our public, that if a case occurs in Orange County, we have protocols and procedures in place. We will be as transparent as we can to let you know what is happening. We also want to let you know we have dedicated a web page with the latest information on coronavirus. It is www.ocfl.net/coronavirus. Our tourism industry remains strong, and you will hear from them shortly. At this time, I'm going to ask Mayor Buddy Dyer of Orlando to come forward and offer comments to you as well. Mayor Dyer.
Thank you, Mayor Demings, and good afternoon. Thank you all for being here. The City of Orlando remains committed to the health of our residents, our visitors, and our employees, and we continue to work closely with our partner agencies, including Orange County and the Florida Department of Health. Internally, we are regularly meeting with the fire chief and the police chief and our department directors to review all of our emergency preparedness checklists so we can ensure continuity of services for all of our residents. A few examples of those: we are now triaging calls for medical help in a more detailed manner as it relates to the virus. We're reviewing our stock of and ensuring we have personal protection equipment for all of our personnel. We've increased the cleaning cycles, and we're adding hand sanitizer to dispensers at the Amway Center and Camping World Stadium. So we're taking responsible measures to ensure the City of Orlando is prepared and encourage everyone else to take care of themselves as you would during any cold or flu season. You'll hear these tips often, but remember, avoid close contact with people who are sick. If you're sick, stay home, and remember to wash your hands, just like you tell your kids to do, at least 20 seconds each time. So we're prepared. There's no reason to panic. We have a long history of working with our partners, and we'll continue the lead of Orange County and the Department of Health. And with that, I'd like to call on Dr.
Good afternoon. My name is Raul Pino. I'm the health officer for the county. And as the mayor said before, we have been working since January in getting ready. And we have plans that we activated in the Ebola crisis that we had before that will be very useful for us during this new health crisis. We have been following a group of individuals in our county that have come from those destinations. Today, I can tell you that, and it's a number that changed by day, but today we are following less than 30 individuals in our county, and these are very, very low-risk individuals. And we have protocols in place, and we follow this individual for 14 days. As we move into a new phase, with the epidemic rapidly evolving and having cases close to our county, we will move in our next phase, which is preparing for the eventuality that we may have a case and how we are going to act if it's a resident or if it's a traveler. And those situations are a little bit different each. But we are prepared to take the necessary steps from a political point of view, but also from a health point of view. We have received legal advice in how to isolate, quarantine, and encourage individuals to take the precautions that they need to in case that we are to face that. With the declaration of the public health emergency today by the governor and the state's surgeon general, it will bring additional resources as well as give us the ability to mobilize our staff rather quick in case that we need to protect and get into action. As I said before, the Department of Health is working closely with all our institutions in the county, including our health facilities, and we have tested individuals in the county for the disease and all being negative. Let me say this again, there is no reason to panic. We are ready to take on this if it comes to our county, and it may be a matter of time, but we are ready to isolate, contain individuals. Thank you very much. Oh, I need to introduce Danny Banks, our Director of Public Safety.
Thank you, Dr. Pino, and thank you all for being here. We, as you've heard our mayors say, we expect the coronavirus to be impacting Orange County. You know, we're in a position in Orange County very similar to hurricane season where we know potentially something is bearing down on us, and we are in a mode of now preparing. And I'll break that down into two different aspects for you. Environments. Our fire department has already implemented some things to ensure the safe and healthy transport of any patients, as well as some other opportunities in our community to clean our environments to kill this virus in its place. And as it continues to expand across Florida and comes into Orange County, we're going to use some of these devices to, again, increase our safety and our health by killing that virus with something called an aeroclave, and you'll see an example of that from our fire department in just a minute. Another avenue we're doing, you heard Mayor Dyer mention this, is using our fire department to help us assess patients in the field, people who are feeling flu-like symptoms who dial 911. Already our dispatchers have for weeks now been doing separate analysis over the phone of those patients, asking them particular questions with regard to their symptoms, so our firefighters and our paramedics know the personal protective equipment they need to don when arriving to that facility, as well as how to help treat that patient and potentially isolate them from others. Second transition is going to our response. When we have an incident in Orange County, we immediately transition into our response. And it's continuing many of the things we've already done, but you heard Dr. Pino mentioned isolating those patients when they come into Orange County. We need to ensure as best we can to prevent those patients from having contact with other individuals. Our effort in response will be focused on minimizing transmission from one infected person to another, and we've got a very aggressive plan in place to do that. Our current campaign, though, is to, as you've heard stated already, promote good hygiene and healthy lifestyle, clean surfaces, use hand sanitizers. If you feel ill, minimize your exposure to others and seek medical care. Stay clear of others who are symptomatic and encourage good hygiene amongst your peers. In Orange County, we will be open about our efforts. We will be transparent about our activities.
Tester, the Executive Director of the Orange County Convention Center.
Thank you, Chief. Thank you for being here today. The safety and well-being of our guests and attendees at the Orange County Convention Center is our priority, and we're putting swift, proactive measures in support of the CDC, and we're in constant contact with our clients and other Orange County Convention Center stakeholders. No conventions have canceled their conventions. Some have implemented handshake-free meetings and noticed a lot more fist bumping around the convention center. The Orange County Convention Center has a disinfectant procedure in place for nightly and day cleanings during move-out and throughout conventions. Other precautionary measures include enhancing on-site communications, signage regarding safe traveler tips, increasing the frequency of cleaning and disinfecting bathrooms and other commonly touched areas like hand railing, door handles, and additional training for our Orange County Convention Center staff. We've also increased the number of hand sanitation sites around the Orange County Convention Center and the campus, providing alcohol-based hand sanitizer for all attendees and staff. And with that, I'd like to introduce George Agell, President and CEO of Visit Orlando.
Thank you, Mark. Good to be here on behalf of the tourism industry. Let me first point out that, as you know, our industry is well known for always making sure that safety is the #1 priority for our guests and our employees. And at Visit Orlando, we're communicating daily with all of these tourism members throughout the region, appropriate officials such as all of those that are represented here. The Convention Center, we have a very close communication and partnership, and of course our visitors. And I will tell you that right now, so far, we've seen no measurable impact in our industry to date. In fact, we've only, monitoring all of our visitor information channels, we've only seen a handful of inquiries so far. And we also are pleased because we're communicating with our tourism businesses who, as we know, practice the highest standards of cleanliness, and we see them even reinforcing that even further now. So our goal at Visit Orlando is to continue to make sure that we're monitoring the situation well, that we continue to ensure the highest degree of responsiveness and communications as the situation evolves with everyone you see here, our membership, our visitors, convention organizers, and anyone else. So we keep them aware of really the incredible standards that we follow here that you've been hearing from those at the press conference today, and we'll continue to look forward to doing more of that as we go forward. Now my pleasure to bring it back to Mayor Demings.
Okay, thank you. As you can see, this is a collaborative effort across all of Orange County. We want to ensure that regardless of where an individual may find themselves here in the county, that there's consistency in how we react or respond to that. While the press conference was going on, we were joined by a couple of additional individuals. Of course, our property appraiser, Mr. Rick Singh, was here already, but we also had Orlando City Commissioner Bakari Burns that joined us, and the others were already previously introduced to you earlier. So at this point, let me just take time to respond to any questions that you may have. We have various experts who have joined us who can answer any of the questions that you may have. Dr.
Mayor, but should we see some kind of outbreak in Orange County, particularly within the tourism sector, have you and your staff and have the staff for Visit Orlando and all the others worked out any scenarios where things might start being closed at all, or is that part of a long-term plan?
Obviously, at this point, we do not, as you've heard from Dr. Pino say, that we do not have any specific cases here in Orange County. If that changes, then that requires, I think, a different response to what occurs here in our community, and we have certain processes that we will institute if that occurs here within this community. I certainly will have Dr. Pino come forward as a representative of the Florida Department of Health. The protocols that we will institute here are consistent with the protocols that have been instituted across the state of Florida as well as across America. So there's overlap there. We certainly are working with the Centers for Disease Control as well. So Dr. Pino, I know that they may have specific questions of you, medical doctor.
So the short answer is yes, we are prepared. We have different plans and scenarios that we exercise, and that is the extreme. And we are hoping that that doesn't happen. I think our main job is to prevent an outbreak from happening, and that's why we will dissent quite strongly if we have any case, and we take all the steps to prevent that from happening. The public should be reassured that I don't think that an outbreak is likely in our county at this point today. It may look different a week from now as the situation is very fluid. And and again, we have tested individual, we have practiced our scenarios, and although that the extreme scenario has been considered as well.
Doctor, to that point, you said you have tested people here in Oregon.
Do this, we have exercised that. But we are going to add additional resources in case that the public feel the need to talk to us or someone may think that they may have. So we have an algorithm. There are three basically scenarios. One, an individual that has traveled to the area and has developed symptoms. One, an individual that, the other scenario is an individual that has developed symptoms, didn't travel to the area, but was in contact with someone who was diagnosed or someone who traveled to the area. And then a third scenario, now that we know there are some community transmission going on in the States, any individual who have developed symptoms and we don't have an explanation for the causes of their disease. So in those three cases, we will proceed and test. Other epidemic spread around the world if it continue to spread. Thankfully, our airport doesn't have any direct flight at this point with any of those places. So the CDC identify individuals who have traveled to those areas. We at that night receive a list of the individuals who have been admitted into the United States. Next day in the morning, the first thing that we do is we have a system that is very sophisticated where we verify the addresses, phone numbers, and any contact information for those individuals. So they move around 9 o'clock into what we have our calling team. So a team of individuals from the health department call those individuals early in the morning, the next day after they arrive. We do a survey on the phone to establish a new assessment of the risk. And then if we establish that contact, then we dispatch a nurse in the afternoon to their home or the place where they are staying in Orlando. And that nurse will deliver thermometers and some necessary sheets where they are lagging their temperature and their vital signs. And if it's very low risk, every 3 days, we'll talk to that individual on the phone to get the backload, and that data is entered to the system. If in the morning we cannot establish contact to the individual, phone is not working, the address is not right, whatever situation may be, we dispatch a nurse, and then what was supposed to take place on the phone will take place in person at the place of residence.
As the list of countries, affected by the virus grows, as it probably will, and let's say we do have a direct flight coming into Orlando International Airport, what procedures are going to be put in place if we have those direct flights coming?
The airport is in better position to answer that question to you, but they do have all hazard plans that is very comprehensive. We are working yes, they work with us.
This is for Greg at Visit Orlando. I know you said that there have been a handful of inquiries. What are the nature of those? Does inquiry mean cancellations? I know Workday canceled its internal sales kickoff, and
At that point, decided it'd be wiser to cancel.
Among companies that had attendees from countries that might be high impact areas.
In that particular case, those happen to interestingly be exactly that kind of group.
What happens if that does happen, that someone does cancel a large conference? It's a lot of revenue for you guys, obviously a lot of business for you guys.
Well, of course, anytime you have any kind of a significant amount of cancellation, that's a concern for us as for anybody else. But of course, at this stage, if it hasn't happened at this time of the year so far, I think particularly given the reassurances of how the county, the Florida Health Department of Health, how everybody's worked together, the way we're communicating very clearly to these organizations, they're being real comforted to a good degree by the way that we're expressing to them the safety and health practices that we're conducting. The hotels, as we know, we're fortunate we have an incredible world-class standard. We have some of the best brands in the world between our theme parks and our hotel brands that have themselves established incredible protocols, incredible health standards that are being communicated and shared with their individual guests. So all of that combined, I think, is adding a great deal of reassurance at this point.
Maybe one more question. On the side over there. The autoclave? Let's finish the press first.
We'll come over to that in just a few moments.
Can we go back to that scenario if I call into the call-in center? Is it the same sort of thing in terms of a phone survey, and then if you determine that this person needs to be brought in for testing, how does that happen? go to that person at their home to get tested, or is transportation arranged for that person to go to a local hospital?
All of that. If an individual call, let's say someone from home, what is important in this is to avoid getting individuals who may feel that they have been exposed to the virus into the community. So stay put, stay in isolation and containment, and we will come to you. The testing will not happen at home. The testing will happen in clinical facility. But the most likely scenario is that someone may feel sick and go to an ER, and that will be assessed there. In that case, also, they are in texting basis and calling basis with our IP team, and we have responded already, as I said, to less than 10 of those cases where have been a suspicion because the person have developed symptoms and have come from an area that has been affected by the disease.
Dr. Pino, how is the coronavirus compared to other viruses you've seen across the country, specifically ones that have come to Florida, and the level of severity compared to other things you've seen as a health expert?
So are you talking about what is the percentage of people who die? Or is it?
That point, but as far as the symptoms go and just the level of severity.
So it's a new infection. We know little, really. I think our concerns with regard to public health and transmission is are individuals who are asymptomatic able to transmit the disease. That's a critical point that we have to establish. And that has not been clearly defined, because that will change the nature of the epidemic. Because when the individual is sick and feeling symptoms, then you immediately look for care, and that will give us the ability to intervene. Our major concern with regard to the epidemic is someone who is asymptomatic and could, we don't know yet, transmit the disease, and that could be the case why we have seen some community cases. But again, the CDC, this is very fluid. We don't know if this is going to be seasonal like the flu. We don't know if the change in the weather coming summer will either affect this in any direction. So it really changed by day. It really changed by day.
Could it possibly be testing kits that come to local hospitals so that they don't have to go to one of the 3 labs in the state?
I don't think that will happen pretty soon. Because in the testing, what happened is at the local level, our state lab will establish a first test, and that will be considered suspicious of. And then the lab also will send a test to the CDC for confirmation. So we are really triangulating testing. And you want to keep some control of the flow of testing that goes into the lab, so that the idea is to those who really need to be tested to get tested and get the results as soon as possible. Because if we backload the test in the labs, then it could be that someone who really need it is behind the testing and will have to wait longer. And what is really important here is to establish diagnosis immediately, treatment, isolation, and containment.
Are hospitals prepared to take in potentially large numbers of people who show up either because they think they have symptoms of the common cold and think it could be coronavirus, or they're perhaps just panic, or someone who has an actual infection?
Well, that's a question for the hospital system, but I can tell you that they are all prepared. They have all plans in place. They have exercised, and they have executed already those plans.
Okay. As we try to conclude the press conference, let me also introduce you to Dr. Yolanda Martinez, who is the Director of Health Services for Orange County government itself. She works very closely with the Florida Department of Health, and that is primarily to ensure that we have great communications between the different entities that have some responsibility in this regard. To sum up what we've said today, let me just remind you that fortunately in this community, we have a lot of experience as a community in dealing with crises. There's really no substitute for that experience that we have, and so I look at the potential for this crisis to be no different than any of the others that we have perhaps had to deal with previously. We have a group of experts who have trained, who have various protocols in place, and so I will say to all of you that we remain cautiously optimistic that if we are impacted directly by this virus, that we will be able to respond adequately to it to reduce the spread of the virus in this particular community. So with that, we will remind you that Chief Fitzgerald, if you have any interest in looking at the apparatus that he alluded to earlier, is here for you to take some photographs of. And if you would like to have any particular one-on-ones with specific individuals, we will try to make them available for you at this time. But thank you all for coming and participating in this press event this afternoon.
Thanks, Scott.